Now we'll go a little bit more into the future. So there was this theory called the Miasma Theory, which was basically during this era called the bad air era, from Middle Ages to the 19th century. As cities grew, epidemics worsened and people needed an explanation. And that explanation came out to be miasma, which was bad air, that is, toxic vapors which arise from filth and decay. Doctors believed that diseases like plague, cholera, and malaria spread through airborne poison and not organisms, which was, reasonable for its time, but one of the cooler things you will see is this fellow over here with a mask, the crow mask. So this is an example of a plague doctor, and the plague doctors wore the crow masks because of the miasma theory. The long beak was stuffed with herbs, flowers, or vinegar-soaked sponges to filter out bad air, which people believe carried the plague. That is why they wore the masks. While this was still a leap forward, it linked disease to environment and public health. It resulted in sanitation, sewage, and urban reforms that saved millions. It pushed doctors to think in terms of epidemiology, not just individuals. Health is shaped by where you live and not just who you are. Which was an incredibly beautiful thing, because then the next part of the video I'll show you to I want you to do a home task if you have the time and energy for it. So your home task is going to be, look at this beautiful gentleman over here and look at this map. So this was a a spot map of deaths from cholera in the Golden Square area. If you guess the name of this gentleman, you get 10 points, and if you're able to read on this and get back to me about what this condition is. I mean, I already told you it's cholera, but how this condition spreads and what was the entire ordeal about this, it would be lovely. And the second home task that I have for you is this lady over here. Her name was Typhoid Mary. So why is this lady, Mary Malton, called as Typhoid Mary? So that's a home task for you.